In March 2016, she was named the National MS Society's first District Activist Leader of the Year. I had the pleasure of giving her that award. She is also a member of the Society's Government Relations Advisory Committee in Ohio. Please help me welcome my very good friend, Samantha Villella.
I don't get a step stool like Barry does. Thank you, Karen, for that introduction. We're making this a little habit. I love it. Good morning. That was good. Thank you, Lorna. Good morning. Good morning. Since my mother was diagnosed with primary progressive MS in 2008, and my sister was diagnosed with relapsing remitting in 2014, I've come to understand the importance of advocacy and the work of this entire society to help individuals with MS and their families, especially as it relates to affordable and adequate health care. That's why I'm humbled and honored to be a part of this panel. So let's meet our crew. Our first panelist spent his career as an aerospace reliability engineer for 33 years. Since retiring in 2012, he has been very active with the Society, volunteering as a district activist leader and an Ohio Government Relations Advisory Committee member. He is also active on disabilities issues, especially access to air travel. Please help me welcome my friend, Scott Bartholomew. Our next panelist was unable to be with us today, Claire McAndrew, who is the Director of Campaigns and Partnerships at Families USA. Unfortunately, she has food poisoning. However, Grant has assured me she did not eat here. So, seriously, I know what that's like. So we're very thankful, but I think Grant said she's doing okay. Next, I'd like to welcome the Senior Counsel to Congressman Lloyd, Doggett, the Chair of the House Ways and Means Health Subcommittee. She oversees the House Affordable Prescription Drug Task Force and the Congressman's healthcare priorities. She was previously a staff attorney with the National Health Law Program and a legal fellow for Senators Richard Blumenthal and Al Franken. Help me welcome Afton Cissell. Our final panelist started with the Society's Public Policy Office in January, leading strategy on policy that improves the day-to-day lives of people living with MS and their families. This includes access to health care, long-term services and supports, and Social Security benefits. Previously, he was the Director of Government Relations for the American Medical Group Association. He also was an advisor to Senator Ron Wyden, the current ranking member of the Senate Finance Committee. Please join me in welcoming Grant Couch. Before we get started, yesterday, as John had instructed you, there are some cards on your tables. Feel free to write down some thoughts and questions that you might have for the panel, and someone will be coming around to collect them. All right, this is a great panel, so I'm excited to get this started. Let's talk about Congress and the administration, Grant, as they're currently considering how to address surprise billing. I know that Claire had spent a lot of time examining this issue, but would you be able to talk about a little bit about surprise billing and what that is?
Sure. So what will happen is you are seen by a provider that is out of network with your health insurance. Often what will happen is the individual is responsible for the difference between the rate that the provider is paid by the insurer. This is also known as balance billing.
So why do people receive surprise bills? How does that happen?
So you have issues such as narrow networks, which means there's a smaller number of providers that actually contract with your insurance company. And to get that, the in-network rate, that healthcare provider has to have a contractual relationship where they have agreed to a certain reimbursement rate for those services.
Great. So I know that Scott has had, unfortunately, a personal experience with this. Scott, are you able to share that story with us and everyone here today?
Sure, I'd like to. I was involved in a serious car accident. I was having some severe neck and head pains, and my primary care physician wanted me to see a neurologist right away. Unfortunately, my neurologist was out of the country, so she recommended a local neurologist that was known to be in our network. I called my health plan twice, and got on the internet and verified that in fact she was in network. So I scheduled an appointment with her. When I showed up, made my copay and was ushered back to get the old blood pressure and temperature check, and was told a different doctor would be coming in to see me. And I asked where the Dr. Aaron was, and they said, well, she's off on maternity leave, and we made a scheduling error. So I decided to stay. It was just a small office with 2 neurologists. Within about 10 days, I received a rather large bill in the mail. And I called my insurance company and the doctor's office, and they said, oh, the doctor you saw is not in your network, so you'll have to pay the bill. Well, I got on the phone, and I called the doctor's office, the insurance company, over and over again for weeks at a time, and I kept appealing. I literally spent hours on the phone, this on hold, dial 5 for this, 4 for that, 3 for that. And finally, in the end, after all this fighting, it was decided I wouldn't have to pay the bill after all. But all this aggravation and stress didn't help me in my daily battle with multiple sclerosis.
Thank you, Scott, for sharing. I know that was a challenging time when you were going through that for you and your wife, Mary Ann. Grant, can you tell me what the society wants to see in any congressional efforts to address this issue?
Sure, that's a great question. So first, surprise billing legislation should make sure that the patient is held harmless. Surprise billing incidents occur because there's a dispute between the provider and the health plan, and the patient shouldn't really be the one that's holding the bag. Also, Congress should recognize that it's not only limited to emergency room situations. A lot of people think that, but Scott's story is a perfect example of where it could happen in it could happen in a different setting than the emergency room. Additionally, patients should be notified before the visit if the provider is out of network. This may not be possible in emergency situations, but Scott's story is an example of where he could have been notified, hey, this person that you're having a visit with is out of network.
Right, that's great. So information, communication. So I also understand that there are some efforts that are happening at the state level to address surprise billing. Will you share a little bit about those state level efforts?
Sure. So according to the Commonwealth Fund, and you'll see that map there, 9 states have protections, comprehensive protections against surprise billing by out-of-network providers in the emergency room and in situations where you're in an in-network facility. 16 states have partial protections, and 25 states, plus the District of Columbia, have no protections. Now, the society has been very active at the state level, advocating for protections for patients from surprise billing, but this graph shows it's really a national problem and needs a federal solution. Also, states are really not able to regulate large employer plans. These are referred to as ERISA plans, so this is like if you have a plan, plan with GE or some sort of large company, states don't really have the authority there to regulate.
Well, it's good. We're making some progress, and hopefully on the federal level we'll continue to do that. Afton, how did surprise billing come to your attention and the Congressman's attention?
Well, we've heard countless constituent stories from patients like all of you about what's been going on. One particular story that picked up a lot of press coverage was an Austin public school teacher. This happened last August, and he had symptoms of a heart attack and was taken to an emergency room that was in his plan's network. He was very specific about where he wanted to go. And as they were wheeling him through the ER, he explicitly asked, will everything be covered by my insurance? Is everything in network? And he was told yes. He was later hit with a surprise medical bill because some people in the points of care were actually out of network. His insurance plan paid $55,000. He was charged $109,000.
Wow, that's crazy. And as the man's being wheeled through the emergency room, he's trying to be coherent enough to ask.
Because he's having a heart attack.
He's having a heart attack because he knows he doesn't want to have that.
Yep, and with a bill like this, a public school teacher obviously cannot afford this. Nobody should be charged something like that.
Absolutely, absolutely. Thank you for sharing that. Scott, I know you, and you are a very educated individual living with multiple sclerosis, and you did take those necessary steps as you had that time to do that. However, you still received a surprise bill. Walk me through that.
Well, basically it felt like just like a big kick right square in the gut. And it shows that you can be knowledgeable about your health care and the situation with your multiple sclerosis, and you can still get a surprise medical bill. Unfortunately, mine wasn't as huge as that fellow with the heart attack. And when we had our car wreck, we were both unconscious, so we didn't really have a choice of what hospital we went to. Thankfully, my hospital was in network. I feel bad for people that didn't know enough to even think about asking. What are they going to do? They're going to get a huge hospital bill. And if they don't have the time or the wherewithal to make all the phone calls that I did, they could end up in collections or have their credit rating ruined or something like that. And as Grant said, there are protections at the state level. Unfortunately, my state in Ohio, I know this is not one of the states that's highlighted, unfortunately. We need federal legislation because this problem is nationwide.
Yeah, absolutely, that's so true. So those who've been impacted, we know healthcare is complicated and it seems like it's an easy ask. So Grant, why hasn't Congress addressed this, or have they, or who are the stakeholders that are part of this debate?
So currently the industry can't come to an agreement. Some people think it's the insurer's fault, some people think it's providers, and the patients are really the one at the center of this, but the industry is sort of duking it out. There are also issues of rate setting in terms of what's the correct rate to pay providers, and also arbitration processes. And some states have done this, but it's not always, it doesn't always work for the patient. So it's trying to figure out how to resolve this without holding the patient responsible.
Which they should definitely not be held responsible. Afton, why now? Why do you think Congress wants to address this?
I mean, there's no perfect answer with any issue when it suddenly becomes hot in Congress. What I can say is this is something that's been many years in the making. This problem has continued to grow. States have been slowly starting to take action on it, but we've seen that sometimes the action is not always effective. So like in the Congressman's home state of Texas, they have a mediation process, but it's actually the patient that has to initiate that. And most don't even know that they have that option. There's actually new proposed legislation to change that, which we're excited about. But as Grant underlined, there are some plans that are only federally regulated anyways. But between state action starting to grow and more press coverage on the issue and constituent stories coming to us, I think that Congress is hitting a moment where they recognize that they need to act, and now.
Great, and then they have all of these activists coming at them tomorrow, so they have to act, right? Right. Grant, are there any bills that are ready to address this issue?
So right now there is no current legislation in Congress to address this issue, but there were a lot of proposals in the last Congress, and we expect those proposals to be put forward this year. In the last Congress, Senators Shaheen and Hassan from New Hampshire, they had bills to address this issue. Also, Senator Cassidy had a discussion draft legislation, and all of them had different ideas to address this issue and put forward various bills. The difference among these bills center around how the payment is determined and who is responsible. So Cassidy's bill sort of goes after the health plans, and they pick up the rest of the tab. So this is probably why we haven't seen legislation this year, because there's a lot of behind-the-scenes work and trying to get the stakeholders on board. So it's still, and I would also say it's still early in the session. You know, earlier in the year we were dealing with a federal government shutdown that took up a lot of Congress's time. This is early in the new Congress, and they're kind of starting to get their bearings on what to do in the new Congress. Some common things among these new bills include protections for patients in emergency room settings, out-of-network care in in-network facilities, and patient notification, so that patients know sort of what their costs could be, or if their physician is out of network. I'd also note that Congressman Doggett has been a leader on this issue, and I'll let Afton talk a little bit more about the bill her boss introduced last Congress.
And we've actually reintroduced it.
Oh, that's great, yeah.
Yay! That's wonderful. Thanks for that update.
So Congressman Doggett has been working on this for many years and had legislation. What his bill would do is that it requires a robust patient consent process, so making sure that patients know ahead of time all of the services they're going to receive, whether those providers are in network or out of network, and how much they can expect to be charged for each of those individual services. And if a patient doesn't consent to any of those, then they can't receive that and be charged that. And then in an emergency situation where they weren't able to provide consent, so say in Scott's case when he was unconscious and so couldn't express, whether he wanted in-network or out-of-network care and how much he was willing to be charged. In those sorts of situations, then the patient could only be charged what they would have been if everything had been in-network, so rates that they were already aware of when they signed up for their health care plan.
So what are some issues, Afton, that need to be addressed in this debate?
Yeah. So the number one priority is protecting the patient in this. As Grant outlined, there's a lot of stakeholders here, a lot of different providers and hospitals and insurance plans. None of them are innocent. They're all doing something wrong in this process. The only person that's innocent here is the patient. And no person should have to fight their insurance provider or their healthcare provider while they're fighting for their health. So the number one priority is making sure that legislation ensures that patients don't bear the brunt of this, that you're not responsible for these high rates, and that any solution we come up with doesn't just shift the burden in a different way to you to where suddenly you're experiencing higher premiums or cost sharing or deductibles. So that's the number one priority. And then moving past that in terms of how we solve that dispute between providers and insurers, there's different approaches that have been used by the states and have been proposed in Congress. There's pros and cons to each of them. When we think about rates, there's a lot of variation depending on where you live and the type of specialty provider that there is there. Sometimes these rates are just far too high and we need to be working to lower healthcare costs altogether, but sometimes they may be justified in the particular set of circumstances. So we have to be really careful when we think about rate setting and figuring out what's going to be the right standard. And when you think about a mediation or arbitration process between the insurance company and the provider, we want to make sure that whoever is there helping them resolve that dispute isn't biased towards one party. So we have to be really careful about that. And then making sure that that process is actually just between the provider and the insurer, that the patient is not forced to have a role in it, including even initiating that.
So there's a lot of issues that we're looking to address. What would the steps be in this next Congress, Afton?
While it seems like a pretty straightforward issue, it's very simple that patients shouldn't bear the burden. It's actually very murky given all of the stakeholders that are involved. And I can tell you Congress is being flooded with emails right now from those stakeholders because they recognize how pressing this issue is and that Congress really does intend to act this session on all of this. So I'm getting emails every single week from different stakeholders telling me it can't be this rate, this is completely unfair, or it must be this process, and they're all coming up with their frameworks. So all of that means that we haven't landed on one particular solution yet because there are so many people involved. The conversations are ongoing. However, they are very active right now in a way that they haven't been in the past. And so I do truly expect legislation this Congress.
That's great. That's really good to hear. Thank you. So what advice, Afton, would you have for those that are heading to the Hill tomorrow and meeting with their legislators?
So the most important thing is to tell your story. That has the biggest impact for making sure that a member of Congress feels the power of this issue and they understand the burden that you are facing, and that of course it is completely unjustified and you shouldn't be dealing with this problem while you're also fighting for your health. And so that story is going to be the thing that motivates them to want to act on this. When you listen to members of Congress in committee hearings or making floor speeches or at town halls, they will often share your stories And so it shows the impact that it has on them. And also part of when you share your story, if you're able to if you are willing for them to share your story with others, give them that permission, because they do like to share them. And so tell them it's okay if you want to use this in a speech, or if you want to put me in contact with our local media so that we can raise some awareness in our district about this issue. We've done a lot of local reporting with some of our constituents that gave that sort of permission. So that's really powerful. The other thing to think about is that policymakers are really data-driven. So if you are able to tell them any sort of statistics that are going on in your particular state, if you can tell them if you have state legislation already and how it's working so far, knowing that no matter what, we need a federal solution, because not all states are acting and not all plans are regulated by the states. Like the federal government, no matter what, has to act here. So making sure that you underscore that for them, and that you should be held harmless in all of this. And then finally, make sure that you have a concrete ask for them. It can be to co-sponsor existing legislation or asking them to write their own, whatever it is, but have a concrete ask that you can follow up with them and say, so did you do this thing that I asked for?
I think those are all great tips, and I know we all appreciate that. And I especially love your tip about sharing your story, because as we saw with Diane earlier and the relationship she has with her senator, how impactful that was and the progress that she's making. So that's great. So this is my favorite part. Scott and I've had the privilege of working together for several years on the Hill, and I'm going to let him share his wow how now.
All right. My wow, well, first off, I'm pretty excited about what Afton just said, that Congress may take action on this situation, this issue this year. That's great news. I'm glad she shared that with us. Wow, I think you've heard my story, but this issue is so widespread, I think there's probably somebody likely to be in your group that's been exposed to this situation. Tell how it impacted them or a loved one. The how, make the point that this can happen to anyone. There's going to be a Kaiser survey in your handouts. You can use that for your data points when you're explaining this. And then now our ask is pass legislation to address surprise billing.
That's great, Scott. Good, because you're prepared tomorrow for our visits. That one's all you. So Grant, what type of, we don't ever want pushback, right? But we know there will be some type of pushback. So what type of questions do you think we may encounter tomorrow when we're on the Hill?
So one that I could think of is, this is a bipartisan issue, but the issue is going to be approach. Some on the Hill think it's the provider's responsibility. Some think it's the insurers that are excluding too many providers to control cost. I think if some staff are asked, who do you think is responsible for this type of behavior? I think you could say that whoever is at fault, we want to make sure that the patient is held harmless.
Great, I think that is obviously the most important point. So we have some questions. The first one is, who is against legislation on surprise billing?
We haven't really seen much opposition, but there is that stakeholder component where you have to be mindful of, and some listen more to the health plan, some listen more to the providers. So the opposition is going to come from, I think, the stakeholders to the extent that they could influence their lawmakers. But you really haven't seen people go against this as a general principle.
Good. Afton, this one is for you, and we hit a little bit on this, but perhaps you could go a little bit more in depth for us. What are specific sticking points you think we might encounter in our meetings tomorrow in lobbying for access to healthcare, and what approaches do you think could help us with any barriers that you foresee?
So I think that Grant is right that people are wondering who's responsible for this. Obviously the patient did not cause this problem and they should be held harmless. And finally all of the stakeholders are agreeing to that principle. I have not seen a single framework that said put it on the patient. All industry stakeholders agree on this. However, they're still fighting about who actually needs to bear the responsibility for this. So that's going to be the big question. Do you think that doctors are charging too much? Or do you think that they're refusing to join these networks because they don't want to accept a lower rate? Do you think that plans are purposefully excluding them from networks in order to control the costs? What do you think the problem is? And I think Grant was right that, you don't need to answer that question, and I'm going to tell you a little secret. It's all of them. All of the above is happening. Like I said, nobody's innocent in this, and all of these are contributing to the problem. So your role is to say, it doesn't really matter. Everybody's at fault, but it is your job to make sure that I am not held accountable for this. It was not my fault. I should not bear the burden, and I'm not capable of doing so. No patient should have to face these kind of costs, and it's your job as a lawmaker to go ahead and resolve that for me.
That's great. That's some great words of wisdom for us for tomorrow. So this one, it might be a mixture between Grant and Afton. Why is surprise billing a federal issue? And what is our response to reps that suggest this is not a federal issue, but rather a state issue? That's a great question.
Well, I think you can make the point about large employer plans. The federal government is the one who oversees those plans. And you could also make the point that you have only half the states have some sort of protections. Only 9 of them have comprehensive protections. So it's really a federal issue because state, can't be resolved just state by state because some are not going to pass legislation to address this.
But I would add the biggest thing to point out is that there are some plans that the states cannot regulate. So no matter what, if all 50 states pass legislation, you'd still have this gap, and there would be a lot of patients still suffering. So no matter what, you have to have a federal solution.
So the state and federal solutions are both needed then?
So the state solutions are great. They've been great for showing us the pros and cons of the different approaches because states have taken a different way of tackling this issue. So they've been good for showing the federal government what they should think about in developing a federal solution. And they are helpful for ensuring that the plans that they can regulate, that those patients are taken care of. But federal legislation will take care of all patients. So all those plans that states are regulating, the federal government also regulates them. So they will be able to take care of all patients, and only the federal government can do that.
Great. So our next question is, would surprise billing legislation help cover out-of-network neurologists in rural communities where there's little or no choice of providers?
I think to the extent that the patient would be, so if they go to an in-network facility, there would be some coverage for that. And if you're in a network facility and you're seen by an out-of-network neurologist, there hopefully would be some protections because you went to the in-network facility. And there's also the notification piece, at least you know, so at least you could plan. And I know that's difficult, especially in rural communities and traveling a long distance, but at least that there would be some notification and there could be plans made accordingly. So it is a huge issue in rural areas, but if you have some protections from in the facility or in the practice, accepting the insurance, being at the in-network rate, and covering some of these out-of-network neurologists.
Afton, would you have anything to add to that about with the legislation that your boss is working on?
So I would say that yes, the patient notification piece is really important. And obviously an issue like this underscores the fact that we have other issues in this space that surprise billing legislation does not fix, such as high healthcare costs and limited provider availability, regardless of whether they accept insurance or not. These are other healthcare issues that have to be addressed. They're not specifically surprise billing, or caused by surprise billing, but surprise billing occurs because we don't have enough providers, and so these are other issues that we absolutely need to be addressing, those rates and the provider availability. But the surprise billing legislation would at least ensure that a patient knew ahead of time what they were getting themselves into, and they could plan accordingly for those costs, and they could try and negotiate with a provider, say that there was only an out-of-network provider that they could see, and they knew in advance of this, they could at least try and negotiate with that provider, hey, I cannot afford this rate, is there something we can do to take care of this?
Great. All right, here's a good one. Can you explain a little bit of the difference between partial protections, comprehensive protection? Do they all look the same?
No. It's So why they have different things? So I can give a great example in Texas. It was highlighted in that map, but it was like a lighter shade of orange, and that is because we have partial protections in Texas. And the reason that it's partial is that we put the burden on the patient. If the patient receives the patient can receive a surprise bill. Two, the way that it gets resolved is that it's on the patient to be doing this, and it's why the mediation process hasn't been taken advantage of as much as it should be, and so patients are not saving as much as they can, and we're putting all the burden on them.
And I mean, Scott shared that in his story, that he was knowledgeable enough to make those calls, but what it did to his MS and that time period of making all those calls.
Exactly, yeah. I've been down this route. I changed disease-modifying therapies over the years, and I've always had to fight with the insurance companies with prior approvals and step therapy, so I had a little experience dealing with them, but as Afton said, why they're going to put the burden on the patient? I don't think so. And putting it all in the doctor's office isn't fair either. I spoke to some doctors that have told me they have to hire 2 or 3 extra staff just to deal with the insurance companies. There's so many rules and regulations they try to jam down the doctor's throats. Well, I guess the best advice is to say, like Afton said, I don't know, you guys can figure it out, but it shouldn't be on the patient.
Right, exactly. Okay, here's one. This may sound naive, but we can't just require that all practitioners in a facility to be in-network providers. It doesn't matter if they are transparent and inform me that they are out of network if they are the only radiologist that can read my x-ray, for example.
That's right. Yeah, that's right. And unfortunately, like I said, we have a lot of other healthcare issues we have to tackle related to these rates. But I do think that knowing in advance is really important, and it does allow you time to try and figure out an alternative plan. But also, this is another issue that Congress needs to deal with, that we need to figure out how do we get more providers trained and incentivize them going to rural areas to serve patients? How do we lower these rates that are being charged? There are a lot of issues we need to cover related to healthcare costs and provider availability.
Great. Okay, here's our next one. All right, the bright lights in my eyes. Okay. With 2020 election approaching, if we end up with a president pushing for universal health care, how would this affect surprise billing legislation?
So it depends on what that actually looks like at the end of the day. Whether it's there's Medicare for all proposals, there's whether we want to just strengthen the ACA and do stuff such as reinsurance. But it's unclear sort of how that will affect surprise billing. I'll just say so Medicare, the current example, the current program we have. There is limits on balance billing if you're someone who participates in Medicare, which 95% of physicians do. There's even limits for non-participating providers in Medicare, about 4%. That don't participate in the program. So if you had something like, that's modeled on Medicare, it could be something more like that. But it's unclear at this point because we're still early.
Right. Afton, would you have any thoughts on that?
No, I think that's right. There's a lot of proposals out there to get to universal coverage, and some of them involve maintaining private insurance coverage for some people. Some involve a mix of Medicaid and Medicare, or Medicaid, Medicare, and private. Like there's so many different combinations to get there, and so we don't know what that would look like, and so it's hard to answer how this would affect surprise billing. And even if you had a Medicare for all system, Medicare does not cover everything as is, and even if you were to expand it to cover more services, it's unlikely we'd get to a point to where Medicare truly covered every type of piece of healthcare that's out there. So no matter what, you may face this at some point.
Absolutely. Okay, so again, this one is, we're getting a lot of questions about this. So what are some of the legislation introduced to combat surprise billing, and both on the House and the Senate side, and do we have bill numbers for anything at this point?
So the Congressman Doggett reintroduced his bill. It's HR 861, the End Surprise Billing Act. That's the only piece of legislation in the House right now. I know that in the Senate there were multiple bills that Grant described. They haven't been reintroduced yet, but I do expect that they will in the next month or so. In Congressman Doggett's approach, it's related to the patient information and consent process and prohibiting them from ever receiving one of these surprise bills. And then in the Senate, there was Senator Cassidy, the bill that he led actually set a rate that insurers were going to have to pay in these situations. And then Senator Hassan, her bill actually had the provider and the insurer go to arbitration. So there are different approaches that are out there. Everybody's still having a conversation about which one we should finally land on.
What was that bill number again?
861.
And that's on the House side.
Correct.
House side 861. Great. Well, thank you so much, Scott, Afton, and Grant for being with us this morning and helping to educate everyone. If you fortunately have not had an experience with surprise billing, you have a great story with Scott's, and of course Afton shared one from Texas as well, so you'll be able to use those tomorrow on your Hill Day. Some final housekeeping. We are done a little early, but we do need you, as soon as we're done, to clear the room. Lunch will be at noon back here in the ballroom, and the staff does need adequate time to set up. At this time, would you please help me thank my panelists for being here today? And also, just help me in thanking the advocacy team and everyone who works for the Society. They work so diligently all year. So I know I couldn't do what I do without Holly. I call her my boss, but this whole team is incredible. So thank you so much, and we'll see you tomorrow on the Hill. Have a great rest of your day.
Hey, before you stand up, can I just take your picture?